Hello, Nicole Lee with Health, Beauty, and More. I have a degree in psychology and an MED in guidance counseling, and I want to talk about dissociative identity disorders and what it is. Usually, anyone that has been diagnosed with this is diagnosed by a psychiatrist with a procedure called DSM-5. And it's something that originates usually from a trauma in early childhood. And so the person dissociates or they take themselves away by using coping mechanisms to dissociate from the trauma that they are facing so they don't have to face it again. There are different ways to dissociate. And a lot of it can be through personality changes. So they maybe get lost into another personality and completely cut off from the mental process that is causing them the trauma. Something that must have happened when they were younger, violence, trauma of any kind that is associated with personality disorders is not that unusual. It really does happen. And it's very similar to borderline personality disorders. And trust comes into play there. So they have difficulty in trusting people. There's plenty of signs that show that a person may have this disorder. They have a distinct split from their identity and their behavior when they have a dissociative identity disorder. And you might see a complete change in behavior as if it's another persona that is coming out of this person's behavior. Sometimes they're imaginary, but they're definitely, they're splitting is what they're doing. They also have symptoms of mood swings, depression, sleep disorders, night terrors, anxiety. They can have panic attacks and phobias. They can have flashbacks or triggers. Sometimes they even have addictions such as drug abuse and alcohol. They might also have some compulsive repetitive behavior and ritualistic behavior. This isn't, not everybody has all of these symptoms. These are just possible symptoms associated with multiple dissociative disorders that may come about. Sometimes there's even psychotic-like symptoms through hearing things, visual hallucinations, eating disorders, even headaches and amnesia, lapses of time seem to go from them. They forget things, that's amnesia. And they might self-sabotage or persecute themselves. They might find themselves doing things they wouldn't normally do, like speeding in the car, driving recklessly, taking money from their employers or friends. But they feel very compelled to do this. And it's described as being a passenger in their body rather than the driver. In other words, they truly believe that they don't have a choice. It isn't the same as schizophrenia. Schizophrenia and dissociative order are sometimes confused, but they are very different. Schizophrenia is more severe. It's a mental illness. It involves chronic or recurrent psychotic behavior. And in those cases, they may hear or see things that aren't real. So they hallucinate. And they get delusional. And then people with schizophrenia do not have multiple personalities. These delusions that schizophrenics have are common psychotic symptoms, even the hallucinations, and particularly in hearing voices. That happens about 50% of the cases of people with schizophrenia. They are also a suicidal risk. Both of them are, actually, because they have severe depression. And suicide attempts can happen quite often with any psychiatric patient. They don't have to go on living like this and not get help, because there are people that will help them through cognitive psychology, for example, will help them through coping mechanisms that they have been using and help them to understand why they behave the way they do. Lots of medications are out that can help them suppress some of the compulsive behaviors and hallucinatory behaviors that happen with some of these people. They do play roles in their personality, though, and environmental triggers and stressors can suddenly cause these events to shift from one altered personality to another. And I think if so many people have these dissociative disorders or recognize them in somebody, it can be life-threatening, and they really need to be treated by a psychiatrist. So both psychiatric and psychological help is very, very helpful. So if you know of anyone that has these symptoms and has been living in this agony and is not getting any help, I think they could be referred to the county where they live to find out who can help them and see if their insurance will cover it. So it's just too bad that it happens to be so common, but when we grow up, as a child, the coping mechanisms that worked for us then, they don't work so well when we become an adult, because adults are supposed to behave like adults. And if we behave like we did as a child, then we're not functionally able to take care of ourselves. So it's very important to seek help, to get tested, to see if there's anything that can be done. Go to a doctor that's going to help you, not hurt you. Do your checking to see what other patients have said and reviewed on the doctors that you choose. Just do what you can, and I recommend getting help as soon as possible for these treatments, whatever the cost, because your life is worth it. Thank you for listening. This is Nicole Lee, Health, Beauty, and More.